Okay, so depression, postpartum depression in this particular case, and medications. So, if you decide to breastfeed, it's very important that you know that there is no safe medication for you to take while you're breastfeeding, as all medications will go through your breast milk. So, if you feel that you need to take medications, make sure that your psychiatrist explains to you what are the risks and benefits of it. And it's usually we have to, um, you know, the benefits have to outweigh the risks. So antidepressants are usually the medications of choice for any type of depressive symptoms and anxiety symptoms. There is multiple medications that we can use. Now, the medication path is it can be a little bit complicated. If you've tried medications in the future or not, we decide which medications could be best for you depending on the type of symptoms that you're showing. So, if you're coming in with symptoms of crying spells and sadness and lack of or sleeping more, sleepiness, worthless, hopeless, we may choose a medication that is different from someone who's coming with lack of energy, lack of motivation, lack of pleasure, and things that usually you enjoy doing. So each medication is different. Now, once you start a medication, I usually only recommend a medication when the patient is being affected significantly by their symptoms in their day to day life. If the symptoms are like right in the middle and it's not really affecting that much, then I usually recommend therapy uh, to be treated. Acupuncture is another way of treating it as well. But if the symptoms are pretty severe and we see that it's affecting, the medication should be recommended. So if I recommend a medication, I want my patient to understand why I'm recommending the medication, what are the side effects possibly that can happen, what to expect. So I usually am very conservative when it comes to the dosages. I start with the lowest dose possible because you never know how the patient can react, and I would rather go up a little bit slowly than bombarding someone with a higher dose or the recommended dose to be started on that particular medication. So the most important part on the process of medications is that you continue to follow up with your doctor. We start with dosages, but we need to follow up. Every 2 weeks, we can have an idea of what you feel or if the medication is the right one or not to be used in your case. Sometimes, we need to keep going up all the way until either the maximum dose is reached or you have side effects for the medication, unless, of course, you respond to the medication. But I particularly only go up if the patient is not giving me any type of improvements from in regards to the symptoms, either by intensity or frequency. It's very important that the medication is combined with psychotherapy, and because as you are trying to treat the symptoms, which by the way, I want to make sure you understand that the medications are not going to be a fix to what's happening. The medications are meant to be used to decrease the amount of symptoms that are coming up so you can really work with what's underlying um, the symptoms, which is usually whatever is causing them to come up in the first place. So the symptoms usually make it harder. So if you're feeling sad and you're feeling worthless and you're feeling hopeless, it will be very hard for you to confront what you're really feeling or what's really triggering that feeling. So what we want is to diminish those symptoms so it's easier to be a little bit more open, more receptive, and easier to confront your own situations in that matter. So you want to make sure that the medications are not quick fix. We don't have magic pills that will take away everything. It's a gradual process. It takes time. So it's something that I want you guys to really understand. Again, everyone is very different. Everyone responds differently to medications. So you can never, decide to go for a medication or not based on someone else's experience. If you think medication is the right thing for you to do, just get yourself educated and oriented by the doctor, get evaluated by a psychiatrist, to see if they believe that medication is the right choice in that moment. Don't get scared. It's not, antidepressants are not addictive in any